Stress fractures are going to be found in the lower leg, but because of what we discussed in the fact that the fibula carries very little weight as compared to the tibia, you are more likely to see a stress fracture in the tibia itself. There are two main types of stress fractures. The first type is a fatigue stress fracture. This is when you have abnormal stress that's been placed on a normally elastic bone. An insufficiency stress fracture is one where you have normal stress on a bone that is mineral deficient. In athletics, in the general population, both types are going to be pretty common. Some considerations that you have to keep in mind thinking that a person may have a stress fracture. What are the sports that they're participating in? Obviously, running sports are sports that you're more likely to see a lower leg stress fracture in. Stress fractures themselves, you'll take a look at the body parts. Are they weight bearing or non-weight bearing? We're going to look at foot type because, as we discussed, when you have a rigid arch, you're more likely to see a stress fracture in the foot. That may translate to the tibia or fibula as well. And then gender, because females are more likely to have stress fractures because of things like the female athlete triad. Mechanism of injury is going to be due to repetitive muscle tension and or fatigue of those muscles, weight-bearing compression that can place stress on the bone, and then that DIF overload, very commonly seen in so many athletics. Signs and symptoms can range from nothing at all, except for a little bit of pain right at the beginning of the stress fracture, to localized edema as it becomes more pronounced, maybe even a palpable mass if there's healing that is trying to take place. The person may find point tenderness in the area of the stress fracture, but we may also have an unknown etiology, making it more difficult to determine these signs and symptoms. When we are looking at manual muscle test, initially there's not going to be any change in any of the muscles that you're testing, such as anterior tibialis. But as you move toward advanced stage, you'll find a decreased strength in both dorsiflexion and plantar flexion because of the inflammation of the muscle near the site of the stress fracture. Special tests will include the same ones that you did before, including the bump test for the tibia, the squeeze test for fibula and tibia, and then the tap test for the tibia and fibula as well. Another test that you can perform is the tuning fork. Now with the tuning fork, it's not proven that this works very well, but when you hit a tuning fork and cause a vibration, placing it on the fibula away from the injury may cause point tenderness at the stress fracture itself. Diagnosis is going to be dependent on the injury, obviously, when it occurs. If you look at this scale here, the diagnosis of a grade 1 can be picked up with a bone scan. A bone scan can have a positive hot spot, which you can kind of see in that lower picture of the skeleton, in as early as 48 to 72 hours post onset of signs and symptoms. So that can be done pretty quickly. An MRI can be done. An X-ray, however, is not going to pick up a stress fracture until you already have a callus forming around the area. And so really this bone scan is going to be your best bet for diagnosing these stress fractures.